The Health Services Committee will now come to order. I'm Senator Favola. I will represent, starting January 10th, just about all of Arlington County. My current district has parts of Fairfax and Loudoun, but the Supreme Court chose to cut off that little part of my district and give me most of Arlington. So I'm pleased to be here. And I will ask the members, starting to my right, your left, to introduce themselves. Go ahead.
Good morning. I'm Delegate Michelle Maldonado, representing District 50 with western end of Prince William County and City of Manassas. And I'm the newly elected representative for District 20, which will incorporate Manassas Park. Good to see everybody. Good morning.
Good morning. My name is Delegate Donna Adams. I am currently representing parts of Chesterfield, Henrico, and Richmond City. I am in my last term due to a multitude of reasons, but I'm glad to be here. I'm also a nurse practitioner and grateful to talk about school health.
Morning. I'm Delegate Roxanne Robinson. I'm on my way out. Another month, and you will no longer see me. And it's probably a lot of you think that's a good thing. Anyway, I currently represent parts of Chesterfield County.
That's absolutely not a good thing, Delegate Robinson. I'm Delegate Mike Cherry. I represent the 74th District, which is all of Colonial Heights and the southern end of Chesterfield County.
Good morning, Becky Bowers, a near citizen member.
Good morning, I'm Angela Moore. I am a representative of the school nurses in Virginia. I'm the current president of Virginia Association of School Nurses. Thank you.
Madam Clerk, by my count, we have a quorum. Would you agree? Okay. It's really your agreement that's necessary. Okay, the first item on our agenda today is the second consideration of our policy for electronic meetings. Members, you should have received this in your packet. This is the second time that you are looking at it. It is the standard policy that most of the commissions have adopted. I think it's useful for us to adopt this because should I need to call a virtual meeting at some point, this would allow me to do that. And also would allow you some flexibility should you need to take time off, miss a meeting, 2 meetings, I guess, no more than 25% of the meetings for personal reasons. So this is important to have on the books. I will ask Mr. Brimmer if he has anything more to add to my presentation.
Thank you, Madam Chair and members of the Commission. Good morning. No, I think you explained it very well, Madam Chair. I did present this, as you mentioned, at the last meeting, and we kind of left it. You took it under advisement, and individual members were going to get in contact if they had any suggestions, but I didn't receive any suggestions, so it's the same policy that I presented last time, just back before you this morning.
Thank you. I'd like a motion to adopt.
Move to adopt.
Rules. Okay, motion has been made and seconded. All those in favor signify by saying aye. Aye. Okay, the chair heard unanimous consent. Is that correct? If anybody wishes to vote no, let me know, or abstain. Hearing none, that passed unanimously. Okay, well, that's good work. I'm glad we got that done. Now we're on item 3, actually. Review of the bill drafts. So I know I asked you to go over some drafts that were relevant to the committee's work that were introduced in 2023. Would you like to make that presentation?
Yeah, thank you, Madam Chair. I do have a couple slides to aid. Just wait for Jillian to pull those up. Let's see. There we go. We can skip that one because you just did the electronic meeting policy. So I'll start with, just as a reminder, it was we talked in concept of, about 2 different items last meeting. So the request was for me to draft language for those, and so I've done that, and we're going to go over those this morning. So the first one was a concept that was presented to you by Delegate Bennett Parker. It has to do with possession and administration of undesignated glucagon. So that bill draft is in your packet. Really, the bulk of it is on page 3, lines 59 to 69. Fairly straightforward bill. Again, we talked about this last time, but the whole structure is permissive. So I'll just provide a brief summary of it, which is that it permits public schools to maintain in a secure location undesignated glucagon that's prescribed by a prescriber. It has to be stored in accordance with manufacturer's instructions, and then the school nurse or another trained employee could administer that glucagon if the student's medication's not available on school grounds or it has expired. And also if, importantly, if the parent and the prescriber has consented in advance. And then after that medication is administered, the school is required to call 911 and then also notify the nurse, the parent, and the prescriber that the medication has been used. So that's it. That's the bill, Madam Chair.
Thank you, Mr. Brimmer. I think the value of this bill is it does lay out a process should schools, systems decide that they want to offer glucagon. And I think the permissive nature is important. I think the fact that we would put it in statute sort of gives the schools some liability protection. And the fact that it lays out a process for the schools to follow is a good thing. My understanding is Delegate Bennett Parker would be introducing this in the 2024 session.
Yes, Madam Chair, that's the plan. Yes, we'd introduce it.
I think this would be a good thing for the commission to endorse or put our stamp of approval behind. But I need a motion. Okay, motion has been made and seconded. I guess the motion was by Delegate Maldonado and seconded by Delegate Adams. All those in favor of endorsing this, and yes, oh yes, of course, Delegate Cherry.
I just want to make sure, and I guess I'm leaning on Delegate Adams here for a quick question. There's no possible negative side effects if this is administered to someone who doesn't need it, i.e. Narcan. If someone is in an overdose, it helps. If they're not in an overdose situation, there's no negative side effect. Is this the same type of a scenario, i.e. someone is misdiagnosed, they really don't need it? Is it going to hurt the individual? That's the only thing I want to know. Do you know that?
Thank you, Madam Chair and Delegate Cherry. You know, it's probably irresponsible to say there is no possible side effect. If for whatever reason somebody was already hyperglycemic, or there's always a possibility of harm. I think the risk is minimal, but there is always risk.
Can I speak?
Yes.
To the issue, as speaking as a person with diabetes and type 1 diabetes, and I'm insulin dependent, having an extra supply of glucagon when your blood sugar is high really won't have that much impact on you. But if your blood sugar is low and you don't get the glucagon and you become unconscious, the results could be devastating, including death.
Yes, Commissioner Moore.
From a school nurse standpoint, may I just put in there that, it's difficult to have anybody just kind of be able to access these medications as we keep adding more and more medications in the closet that are just stock medications, when it does require a registered nurse to do an assessment. It has to be a registered nurse or higher, a nurse practitioner, a medical doctor. So if we have just anybody trained, it's really not fair to put that on them to know what to go, are we grabbing the albuterol, are we grabbing the stock EpiPen, are we grabbing, the Narcan, are we grabbing this medication? So without a registered nurse in every school, it's really difficult and unfair, and the liability is huge to put more and more medications in schools. So I really feel like that has to be on the table first, a registered nurse, before we put all these medications in there. Another thing on this that really I don't know is practical is to contact the physician afterwards, because before we contact any physician, we have to have parental consent to do that. And I will just tell you, a lot of parents are not going to give you consent to contact their physician for a number of reasons. So, usually that's up to the parent to contact the physician, after a medication's given. A lot of times they, if it's emergency medication, we call EMS and they go straight to the emergency room. So, they're already in contact with the physician in that manner. So I would just think that through. Thank you.
Okay, thank you, Ms. Moore. I will note, though, that this is permissive, so we're not mandating that schools provide this. Okay. Is there other discussion on this? Delegate Adams.
Thank you, Madam Chair. I agree with both the comments that were just made. There are more, again, whenever you're administering medications, side effects can come from not just the medicine, or complications come from not just the medicine. I do think, too, since we don't have a clear definition of what a school nurse means, that does matter. Registered nurses are independent providers. They are not tied to a physician. They're not tied to anyone. LPNs, on the other hand, they cannot practice independently. So these things do actually matter. And while it's permissive, it is true too. If you are somebody who is now, we're building now a mini pharmacy potentially accessible, mistakes happen. And so I think it really is important to, this is very important, I think it should be done, but I think the words matter, the structure matters, and the liability matters.
Well, let me ask Mr. Brimmer, is there any suggested changes to the language that would sort of address sort of any negative impact or potential negative impact if somebody suffered some significant consequence as a result of the glucagon? I have one question. When it said a trained, somebody who was trained in the administration, is there a special certificate you would get? What does trained mean? Does that mean that, would somebody by definition be a nurse, either an LPN or an RN? That was one of my questions.
Yeah, I'm not certain about certification. The nurses on the committee may be able to help me with that. I think it would just be a matter of, like any other training, just teaching how to, do
Like
that
CPR.
injection, where and how, and yeah.
Right.
I'm not certain of any specifics of the programs that are out there to train.
Because that is sort of some protection there, because school systems can ensure that the individual is trained.
So
Ms.
there would
Moore?
be training provided. Usually it's by the registered nurse to sign people off and to make sure that they would be, have return demonstration and those types of things. Registered nurses, just by trade would not need to be checked off on that because they're already licensed registered nurses. Typically LPNs should be checked off by the registered nurse because they have to fall underneath the scope of a registered nurse. And then it should be every single year, every clinic assistant, everybody who might be over top of a child who has that as an emergency medication would need to be checked off every single year to make sure that their training's complete, make sure they understand what signs and symptoms to look for, and to make sure that they could use that medication effectively and signed off on their skills for that.
Well, we've had a really good conversation. We do have a motion before us, though. So it's been made and seconded. I think I'm going to call for a vote. Again, this is just an endorsement of this proposal. This proposal has to go through the full legislative process. It will be heard by the appropriate committees. More speakers will comment on this. So this sort of just gets it moving. And it's going to move with or without our endorsement, I also want to add. Okay, so it's just whether we feel that there's significant benefits that we do want to say it's a good thing. So all those in favor of the motion signify by saying aye. Aye. Okay, does anybody wish to vote no, or does anybody wish to abstain? Okay, hearing none, then the committee will endorse this through a unanimous vote. Thank you, colleagues. Okay, Mr. Brimmer, I think you have another bill before us.
Yes, Madam Chair, the next bill in your packet pertains to the qualifications and staffing levels of school nurses. The bill itself also is fairly simple. It's just on lines 195 to 98 on page 8, and at the very end of the bill, on lines 460 to 464 on page 18, is really the meat of the bill. So background on this one, last meeting you requested that me and Angela Moore and Delegate Adams would meet to come up with some bill language. So we did that last month. We had a good conversation, and so the bill in your packet is what came out of that collaborative process. And very simply, the bill would just require school boards to employ at least one full-time equivalent school nurse position in each elementary, middle, and high school, and then require each such nurse to be a registered nurse engaged in the specialized practice of nursing, who protects and promotes student health, facilitates optimal development, and advances academic success. And then the bill also provides that LPNs that are employed as school nurses, as of the effective date of the bill, are permitted to continue to be employed until July 1, 2029, so for the following 5 years, and that each such school nurse is encouraged to pursue before that deadline the training and qualifications that are required to become a registered nurse to meet the new standard of and definition of school nurse in schools. So that's the bill, Madam Chair. Happy to answer any questions.
Thank you. Okay, so I think this bill is going to precipitate some questions. I will turn to the subcommittee members to see if you want to add anything further to Mr. Brimmer's comments. Oh, okay, before I call on my subcommittee members, Delegate Cherry.
One, I absolutely support the concept of a school nurse in every school. I think that is very valuable. Two challenges I have with this is, one, when we say shall, and we're already facing nurse shortages across the board, where are they going to come from? And so I understand the addition of the 5-year moratorium to allow the LPNs to get their RN and to progress, but serving on HWI as I do, I'm constantly in contact with hospitals, hospital systems, nurses that are screaming for staffing. They're overpaying, and I want to use that word gently because I don't want to offend anyone, for travel nurses that are going around with exorbitant salaries, some of them, but they have to do that to get manning. And then if we're going to say you have to do this, where are they going to come from? Two is, I think if we, the state, say you have to do something, we should fund that. I'm a local government guy, and I'm not going to vote for an unfunded mandate. And so this really becomes an unfunded mandate when we say school boards must. And so where are they going to get the staff from, and who's going to pay for it? And so those are the two challenges I have with supporting this. Again, I love the concept. I think it should be. But I don't think we, the state, should be able to say you will and then not tell you where the money's coming from and not tell you where the staff's coming from. So those are my challenges.
Those are legitimate concerns. They certainly are. And your point about an unfunded mandate would not be welcomed by our school systems, nor by local government either, where in some jurisdictions, a fair amount of funding for our schools come from local government. So, and JLARC, as many of you know, issued a report that says the state is, on a per pupil basis, severely underfunding our schools. So this will be looked at in that context. But let me turn to Delegate Adams.
Thank you, Madam Chair. To Delegate Cherry's point, That's exactly the philosophical question we should have. When we look at school health and child development, it's really important that we understand that our childhood is a different experience. It's a memory. It is not the childhood of today. And kids are faced with a whole host of health challenges that we just weren't faced with at all. Everything from obesity and obesity-related disease, malnutrition because the food supply is poor, inactivity because they don't have to go to PE, and mental health challenges. We have increasing needs for children to receive medications. We have a over-prescriptive problem with medications for things like ADD and ADHD. And so the world of school health and health monitoring has become just a different entity. When we also look at the fact that we are facing a workforce challenge, we're talking about a kind of job with different stressors and different focuses than acute care. So I think it becomes a really a philosophical question of risk-benefit. I think when you pay nurses fairly for the job that they're going to do, they will show up. This is a big job in a different way than acute care because the ratio is different. So in acute care, it's very intense, and you have a ratio depending on the level of care of 1 to 2 to 1 to 8, 9. Now we're talking about 1 to a school. And so historically, school nurses have been paid really poorly, but the job has changed. So while it would be, if we didn't fund it, it would be an unfunded mandate, but my point to this is that if our children are as important as they are to every parent, if we think of that from a more global community perspective, then what better investment? And many of these kids never see a primary care doctor. And so this is maybe their one time to see a competent medical professional to notice these health challenges. So I agree with you, Delegate Cherry, that this is potentially a mandate, and without a budget, it's unfunded. But I can't think of a better investment in our children's health, given where we are in society today.
I have a question. Did the subcommittee think about maybe looking at only Title I schools where arguably, you know, the free and reduced lunch is a marker for poverty, and you could make a case that our Title I schools are in underserved communities overall and may not have access to health care, and those children may not have, you know, the benefits of even a medical home. I mean, that might be one way to start eating away at this, understanding that you would like it to be across the board in every school. But there certainly are differences in the populations in our different schools. There just are. I mean, in terms of their wealth, access to services, all kinds of things. Ms. Moore.
So we didn't particularly look at it within the subcommittee, but within my district, we actually did look at that when we were getting more nurses to be able to place them in more schools. And we looked at it in all different kinds of ways. We looked at it according to who had the most individualized health care plans, who had the highest needs where they needed individualized care. We looked at, you know, who had English as a second language. We did Title I. We broke down every single thing. And the Title I schools had no more needs in terms of medical care than any other school. So we broke that down, and I'm in a very large division. So to have that data in front of us and to be able to look at all that, it was a really high indicator of, you know, we can't just say that the school with the biggest number of population is where we need to put the nurses, because really that's not the case. And we can't say that the high school had the higher needs than the elementary school because the numbers are there. You know, you can't just tell by location where the highest number of students with diabetes are going to be. You know, we have some elementary schools that have 8 to 10 students with diabetes, and we have some higher populations in high schools, you know, with 2,000 students that might only have 5 or 6 students with diabetes. So how do you justify, we're going to put the nurse here and leave these other students without the registered nurse caring for them? Like, where do you put your money to say that these students deserve the care and these students over here don't? And it could literally be 2 blocks away on where that is. So equitably, how do you do that? So eventually, we ended up putting a nurse in every school, and that was the best decision that we made. So it's really hard to determine. It's not based on numbers. It's not based on Title I or ESL or anything like that. And a lot of times, the students with Title I, they are the students who have Medicaid, so they actually do have access to care. And that's why, Medicaid billing in schools is a great thing because, we have nurses who can do those types of
It's interesting,
assessments and
you make a valid point. Schools can do this now if they feel that it's a need or that it rises to the level of priority in their budget discussions. So, yes, it can be done now. I have to align myself somewhat with Delegate Sherry's comments, though. I really can't support a mandate. And the registered nurse, I think, gives me some pause. I think LPNs could do the job as well. And I noticed that on lines 460 to 464, we sort of have a good phase-in where licensed practical nurses, if they're already employed as of July 1, 2024, they can continue to be employed until July 1, 2029. And the expectation is they would get their RN. But do I read this correctly? After July 1, 2029, everybody would have to be a registered nurse in the schools. Is that the correct reading? Yeah, okay. Okay, colleagues, I don't know what exactly we should do here other than,
And I did ask somebody to come in and speak from Virginia Association of School Nurses just to give a presentation to see if, they can give a little bit more information on, why we're requesting the registered nurse, what more
well,
information on what they do.
I don't think there's any question on the need.
Okay.
I don't think.
There is a difference in their scope of practice, which is a huge thing on what a registered nurse is allowed and able to do according to the Board of Nursing. So licensed practical nurses are not allowed to do a lot of the things that are needed and necessary and mandated by nurses in the school. And these are legal mandates that we have to do vision, hearing screenings, and we have to do certain things.
I think it was a question of a workforce issue, and it might be easier to keep licensed practical nurses, or it might be easier to hire them than registered nurses. So it was more giving options. But I don't think the committee is, unless I'm wrong, I don't think we're debating necessarily the need for this. I think the issue before us is trying to find a pathway forward. Am I wrong on that? No, I agree. And it's not. The question is the mandate, and we're not going to be able to fund that in this year. So, in school, we can encourage. We can I don't know if we can, maybe add language to our at-risk formula that says, priority or consideration for nurses in every school. I don't know if would that be considered a mandate if we added language to the at-risk pass-through?
No, I don't, Madam Chair, I don't think it necessarily would. Also, Madam Chair, I'm just remembering, Ms. Moore and Delegate Adams and myself did request some data from DOE. I have a couple slides on that.
Go ahead.
Before you move on,
Yeah.
I think it might be helpful for your deliberations just to kind of consider what they provided to us, because I think it was really useful and illuminating. So we did ask DOE to provide us a sense of the current coverage and also maybe a sense of the funding that it would take to fund an RN in every school. So the good news was that they, for the first time in 22, 23, in their data collection, they did mandate a response to the question of how are you employing school nurses in your schools. So as you can see here, 1,932 schools responded. That's nearly 100% of the schools, so it's a good, gives you a good sense of where things stand. Of those, roughly 68% have full-time registered nurses, roughly 14% have full-time LPNs, another roughly 14% have what's referred to as unlicensed assistive persons. Most of those are in Fairfax and Loudoun. And then another 2% have a part-time RN, most of those being in Arlington, with a part-time unlicensed assistive person staffing the rest of the day. And then roughly 1% or 19 schools are unstaffed. So they broke that data down in a slightly different way, and to say that roughly 18% of schools are unstaffed, understaffed, or staffed by unlicensed personnel, and then 82% of schools are staffed by a licensed nurse, whether that's an RN or an LPN, and then 68% of that, 68% of that being an RN. And then just quickly on the funding piece, so that amounts to 622 RNs that would be required to be hired in full-time status based on that 2022-2023 school year data. And then they did also report to us that from a similar request in 2018, the additional state cost of a similar proposal then was $4 million per fiscal year in the relevant biennium. And then obviously these funds would be distributed through basic aid, so there'd be the state local match required too. So just thought it would be helpful for you to have that data from DOE. Again.
Jerry?
Just a comment to that data. That's really good, I think. I'm actually kind of blown away by that, of how good we are doing, or the school districts are doing. I guess it's not us. They're doing it on their own because they've recognized the value in it. They see the need, and they're doing that. So that's eye-opening, and thank you for bringing that, because when almost over 82% are staffed, that's darn good, I think. So thank you for that.
So I did send out an email to all of the VASN members on Friday and asked them, what their comments were, what their recommendation would be. And we have both registered nurses and LPNs, and I wanted to make sure I was representing all of our members. So I gave them, a prompt, like, why do we need a registered nurse in all of our schools? And I think a couple of them who were pretty passionate sent out emails to all the members, which I encouraged them to do that. So this stack right here, which I received 52 emails back between Friday, and I still receive more today, but every single one of them recognized the need for a nurse in every school. Every one of them did. And this was brought up by a conference that we had the first weekend in November. Everyone who's a registered nurse, recognize the fact that it needs to be a registered nurse, because they know by the scope of their practice that a registered nurse has to be the one to oversee everybody. They have to be in charge of every LPN. An LPN cannot be in charge of themselves, so they'd have to have an RN over top of them. And it's extra work for every RN to know that I'm not only in charge of my students, but I'm in charge of possibly 8 more buildings as well. The LPNs, I asked them, if something like this happened, would you want to be grandfathered in if possible, or would you rather, have 5 years to get your RN license and see if we can find you funding or things like that? Not one LPN was interested in getting their RN. Reason being, if I wanted to have my RN, I would have already done that. So they are all interested in keeping their jobs. They know their students. They know them well. They feel like they already have that relationship. So knowing that, and knowing that's who I represent, are all the school nurses, like I would say that it would, at this point, after receiving all that feedback, possibly make sense for the RNs to move forward with getting RNs, and the LPNs already in place to just be grandfathered in, and then moving forward to replace them with RNs if they retire or, if they resign.
I have a question. On the staffing, this doesn't necessarily mean it was full-time in every school, does it? I mean, that's the question. Was it
Yeah, Madam Chair, the data that they did provide us, and I apologize, I should have mentioned this. Let me move back one slide. Where it says FT, that was what they were using for shorthand for full-time, and then PT would be part-time. So, so there are 47 schools with a part-time RN staff,
RN staff.
but then the 68% was full-time.
You just did the math, yeah. Well, what gives me some comfort is 82% of the school systems are staffed by an RN or an LPN. So I'm just curious, the remaining schools that don't have an RN or an LPN staffed, what do they look like? What is their profile? What kind of, they may need extra, because we might be able to target money to the profile of the school that doesn't have the RN or the LPN. Did that come out in the study? It did not, okay.
Yeah, we didn't have that data when we had our subcommittee meeting.
Okay, well, colleagues, I would like to look at the at-risk funding formula and see if we can maybe make a suggestion that school systems consider an RN or an LPN in schools that are benefiting from the at-risk money.
Madam Chair.
Yes, Delegate Adams.
Would it be possible, though, for us to maybe switch, edit the language now that does use grandfathering as opposed to the phase-in, and potentially approve this conceptually and have the details of how we might look at a budget amendment to target funding to support a mandate? Would that even be a possibility?
Well, I think the mandate's still in there in your
It is.
in your thing. The thing is I feel uncomfortable passing legislation that would have the mandate in it, and absent the funding. So, we passed SOQs, their mandates. We didn't fund. We're not funding all of them. So school systems are going to come back and say, now, wait a minute, I'm not getting full funding for the SOQs. And these were all mandates. So, at the end of the day, what we require of our school systems is pretty rigorous. And unfortunately, we're not putting money on the table. But I am willing to put priority language in on some of our funding streams. I think that's the best I don't know, that's where my comfort level is at the moment. And I would like to learn more about the school systems who don't have RNs or LPNs, too.
Madam Chair, may I ask a question?
Delegate Adams.
So I guess my question is, priority languaging, what does that exactly mean? Because I think I totally understand what you're saying, and I also understand the relationship that everybody's fighting for the same dollar. I get that. But I think when you kind of just do a cost-benefit analysis of children's health and the outcome potentials, I just think they're just so high when it comes to child development and welfare. So I'm not sure what targeted language would mean, and what and what language you could use to substitute that said, in effect, you should do this unless you can't, is what I think is what you're saying.
Sort of where I'm going, yeah.
Right.
You should do this unless you can't, which is probably at least a layperson's more direct way of saying what I want to say. And then I'd like to see what happens. And then if we can get more and more schools actually do it, then the delta would be smaller, and we might be able to fund the delta. I don't know. Of course, then the schools that are already doing it are saying, oh, well, I'm being disadvantaged because I stepped up and did the right thing. That'll be. Yes, Delegate Maldonado.
Thank you, Madam Chair. So I'm really thankful for these numbers, because that was my original question a while ago, is what would be the fiscal impact? So when we look at the breakdown of full-time versus part-time versus unstaffed at all, I think that, one, I can't support an unfunded mandate. They've made it very clear, and I don't disagree. There's a lot that our folks are asked to carry, and we've even seen with teacher pay raise that some of them don't get it, even though we give our portion, because they can't afford that. So in the unstaffed piece, that's 0.98%, and if nothing else, I think we should be looking at the unstaffed that have nothing. We should understand what is happening with those, and if they are borrowing from other schools that don't even equate to part-time. But if there's no coverage and no support in those schools, we should do a deeper dive and understand that. And that, to me, seems like a priority way, so that there's no student that has no nursing support or resources in their schools. And then, of course, looking at, our Title I schools, the reason why I'm suggesting that we think about that, and that may come as part of this negotiation after this meeting and on the floor in the committees, is because with our Title I, as we mentioned, our students will have access through Medicaid and some other resources, but we're not clear about what's happening here in the unstaffed.
So, for first step, why
Madam
don't...
Chair, I just have one.
Yes.
I've been struggling with thinking about what makes Chesterfield, for example, different. They made a commitment to have a registered nurse in every school. From school divisions that haven't made that commitment, money's a problem everywhere. Is there some kind, and I don't know where to go with this, I've just been thinking about, is there some kind of learning that can take place to help schools understand that the educational benefit to the health of the health of their children that are in the schools? I don't know where to go with that, but I think about Chesterfield as kind of the case that said, yeah, we're going to do this, and they did it. And I don't know what we could do to incentivize other school divisions that haven't made that commitment yet, for one reason or another, to help them get over the kind of cognitive fiscal hump, so to speak. I don't know where we go with that. I just felt like I needed to say it.
Well, we could add language maybe to the DOE appropriation portion of our budget, which asks them to do an educational effort to all school systems on the benefit of having a nurse available. So we can, I was thinking about that too. Why don't we put that in a motion? Is that your motion, Ms. Lanier?
It's getting close.
Okay.
Would that
Did you want to do more?
Would that be a budget amendment? Would we be asking the Department of Education to pull together a work group that would do a comparative analysis, for example? I don't know where we go with that.
I don't want to get, mine didn't have a big fiscal impact. It would be the Department of Education.
Department of Education, right.
Working with stakeholders to develop and disseminate.
So it would be a resolution then?
Well, I was going to get it into the budget.
Well, that's what I said, a budget amendment that would have the DOE do that.
Yeah.
Okay.
So
Yeah,
they would work with stakeholders to develop and disseminate educational information to our school systems on the value of having a nurse in every school, the benefits. And I don't know if they would need money to do it, if they might. I'm sorry, what were you thinking?
I don't know. I hadn't gotten there yet. I'm still trying to struggle my way through it.
They would have to work with the Department of Health and other
stakeholder groups.
Yes.
Yes, they would have to work with other groups.
And particularly school systems.
Using the models of the school divisions that are already achieving
Right.
that.
We probably wouldn't put all that detail.
Yeah, no, of
into a
course,
budget.
That's why I say I'm still kind of ruminating over it. But I do think that might be useful as an incremental approach to get to where we want to go.
I think that's right. With this, we have to consider this a long-term pathway. Again, I don't think there's disagreement on the value or where we want to end up. It's creating a pathway that's going to get us there.
Yeah,
So,
I
but-
agree.
So, okay, you made a motion.
I was halfway through it. Budget amendment.
And that pesky chair put words in your mouth.
Requiring the Department of Education to convene a work group.
With relevant stakeholders to identify the benefits of the benefits of having a nurse in each school, perhaps relying on models where we've had
Models already in
successes.
existence,
Yeah,
yes.
we've got more.
That's where I would like to see your school superintendent get with a school superintendent in somewhere else where they don't have it and do that kind of,
Okay, so that.
yeah, that's, I'm sorry.
Mr. Bremer, is that okay?
Did you get that?
That we move forward? Okay.
Okay.
All right, I need a second. Second, okay. All those in favor of moving forward with this budget language, and it might cost something, signify by saying aye. Aye. But that's okay. We'll come up with, they may need, I don't know, 100,000. They seem to need 100,000 for anything I ask them to do. But, so, okay, so that's step one. And then,
I have another
and then I have another question. Go ahead.
Another thing that has come up multiple times is honestly whether the definition of a school nurse already exists. By two things that are already out on the internet as of yesterday when I looked, because the DOE does have a definition for a school nurse, and that definition of a school nurse says that it's a professional nurse. The definition is a professional nurse. And the Board of Nursing also has a definition for a registered nurse. And the only person who is defined as a professional nurse is a registered nurse. So if you put a registered nurse and know that DOE has already defined a school nurse as a professional nurse, the only nurse who is a professional nurse is a registered nurse.
Well, let's.
So we wonder if DOE has already defined a school nurse as the registered nurse.
You can ask, but I doubt it.
I doubt it.
So with that,
well, let-
we just want to know if that can be,
Well, that
Deduced?
that might come out in this study language.
so if that can be looked at also.
Okay, and the other question is, I think as we move forward I don't know if we could do it at our next meeting, but we need to understand what's going on in the schools that don't have a nurse. And where they are, and, if they're in areas where there really are scarce resources for healthcare, for mental health, we really do need to understand that, because we can maybe package this as a whole, community health thing. Maybe these are schools that need a community health presence right in the school system to serve parents and others. That would be helpful. So I don't know, Mr. Bremer, would you be the one that would do this, or how do we get this done? To me, it sounds like a big effort.
Yeah, Madam Chair, I can follow up with DOE. They might have a profile for those 19 schools. I'll just ask and
Because this
we
is
can go from
actually
there.
a second, maybe I could put that in budget language too. This would be a second, it would be costly, because they'll have to hire a consultant, I would think, to go out and figure out where the school systems are that don't have nurses, why they don't have nurses, whether there are other health resources available. Would you say that the Department of Education would probably need resources to figure that out?
On that one, Madam Chair, I would think so. Yeah, I think that would
So it'd be
require some staff.
Okay, so if you don't mind, I probably need a motion on that.
Looking at me, look at
Oh, Delegate Cherry, are you comfortable with that? And I'm sorry, we had to
So
work.
it's a motion to ask DOE to give us the data on the schools that are
That do not have
Staffed.
nurses. Yep, and to tell us a little bit about their profile of the schools and where those schools are located, and
Yes.
if there are other community health resources.
That's my motion.
Okay. Delegate Maldonado seconds that motion. We are such a collegial group. I could not be happier. Okay. I know this is not a major step, but we're getting there. These are good steps forward, and we're going to keep working on this, and I think that's where we are on this.
Vote that as well.
We do. So a motion has been made and seconded. All those in favor signify by saying aye. Aye. Does anybody wish to abstain or say no? Okay, hearing none, that motion passes unanimously. Okay, let's go to item 4. I don't see Dr. Robin Whalen here. Am I? Is she here?
She's behind the chair.
Oh, she was behind, yes. Okay. Dr. Whalen, please come forward. Thank you, Mr. Brimmer. Good morning. Thank you for joining us. I'm sorry you had to drive in the rain, but
Great, thank you.
is this in our packet, or is it just?
No, I don't believe so, but you have it, and you have my talking points to share. Great, thank you. So, good morning. My name, Madam Chair, members of the committee, I am thrilled to be here. My name is Robin Wallen, and it's an honor and a privilege to have an opportunity to speak about school health, which has been my passion for so many years throughout my career. Even if you do not have your own children, all of us are connected. I'm sorry. All of us are connected to children. We have children, we know children, or we simply depend on children to be the future of our communities, our commonwealth, and our nation. We all share in the responsibility to ensure that today's children have the opportunity to grow and learn and be healthy. And as a pediatric nurse practitioner, school nurse, and school district health leader for the past 38 years in my career, I have come to passionately embrace the importance of professional school nurses in helping to keep our students healthy, safe, and ready to learn. I believe that every child deserves to be served by a school nurse. Today, I'd like to share with you why I believe mandating a registered nurse to provide professional school nursing services in every Virginia school is a national, state, local, and indeed personal imperative. First, I believe mandating a school nurse in every Virginia school is important because school nurses promote wellness through prevention and early intervention services, providing a healthy foundation for learning and improving educational outcomes. Health is foundational for learning, and school nurses are on the front line of public health, often serving as the only healthcare provider for children and families who lack access to consistent primary care. School nurses actively work to promote wellness of students and staff and prevent the spread of communicable diseases, working with families and community partners to ensure that students are adequately immunized is an important role of school nurses. School nurses work continuously to ensure that students are protected from vaccine-preventable diseases and get the vaccines needed and mandated to help keep both themselves healthy and the school environment. In many school districts, school nurses have been instrumental in facilitating school-located vaccine events in partnership with community providers and public health departments. The COVID-19 pandemic gave us all a lesson in the value of professional school nursing services through the monumental work of conducting contact tracing, educating school staff and students and families about infection prevention strategies, participating in school COVID planning teams, and collaborating with health departments to ensure that COVID outbreaks were addressed and contained, allowing school to continue in person. Another way school nurses promote student wellness is through providing screenings for vision, hearing, and oral health in order to identify these potential barriers to learning. Care coordination and care plan development by school nurses helps to facilitate interventions to work collaboratively with parents and healthcare providers to connect students to the services and health accommodations necessary to be at school safely and successfully. School nurses are also critical partners in the efforts to improve attendance, address chronic absenteeism, and support the academic success of students. They serve as the health leader in the school setting and partner with other school staff to address health barriers to attendance and learning. When I reflect on the impact that one registered nurse can have in a school, I remember a young student who was not able to sit still and pay attention in class. Because of this behavior, his teacher referred him for evaluation for special education services. After screening the student, it was the school nurse who discovered that the student's real problem was massive dental caries, and his pain was the barrier that kept him from being able to learn. After his teeth were repaired, the student was no longer inattentive and was able to learn. Without a school nurse to make this assessment, care and remediation would likely have been delayed, and this student would have continued to struggle with learning. A second reason mandating a school nurse in every Virginia school is important is that we're serving students with ever more complex and chronic health needs. The CDC has reported that more than 40% of school-age children and teens have at least one chronic health condition. In many places, however, that statistic is actually much higher. School nurses are providing direct care, medication administration, and supporting students and families through care coordination and education to ensure that students have the support and services they need. Researchers at the CDC have reported that there's a cost savings of school nursing services by demonstrating that for every dollar invested in a school nurse, there's a societal gain of $2.20. Caring for students with asthma, diabetes, life-threatening food allergies, seizure disorders, and a myriad of other life-challenging health needs requires skilled nursing assessment and professional judgment that are within the scope and practice of registered nurses. Thirdly, mandating a school nurse in every Virginia school is important because social conditions that contribute to poor health are more common than ever. In public health, we sometimes refer to these as the social determinants of health. I like, however, the term that was coined by the Center for Health and Healthcare in Schools. They call these social concerns the social influencers of health and education. Here on the screen, you can see examples of the kinds of social influencers that are impacting our schools significantly every day. This includes housing instability and homelessness, community violence, parental unemployment and underemployment, food insecurity, trauma, and inadequate physical space. One thing I love most about this term, however, is that it leaves room for the possibility of change and positive outcomes for children and families. School nurses provide essential services to help address these social influencers of health and education in Virginia school-age children. Title I program funding provides funding for supplemental assistance for schools with high concentrations of students living under low-income circumstances. I had the opportunity to reach out to some school nurses serving Title I schools in Virginia to get a sense from them about the most significant challenges they are facing in their school populations. Social and health concerns were primary concerns for these school health professionals. Truly, school nurses and schools cannot begin to adequately respond to these social and health influences without the support of professional nursing services. A fourth reason for mandating a school nurse in every Virginia school is that schools now more than ever are navigating the rising mental health needs of students. School nurses are critical team members equipped to respond to this emerging reality. It's been estimated that 33% of a school nurse's day is spent addressing the mental and emotional health needs of students. Up to 20% of our students suffer from conditions such as anxiety, depression, bullying, and stress. I spent some time talking with a school nurse recently about the magnitude of mental health concerns in her school and the ways that she's been able to support students. This registered nurse has expertise in mental health and assessment and is amazingly compassionate and caring. She told me about a young student who suffered from severe anxiety and did not want to come to school. She was chronically absent, and when she did come to school, she would have panic attacks and not be available emotionally for learning. The school nurse, in collaboration with the student's mental health counselor, was able to create a supportive environment in the school health office for the student to decompress. And when she was feeling anxious, the school nurse provided calming techniques and strategies and consistent caring support with the student. Thanks to the support of the school nurse, this student was able to come to school and stay in class without anxiety in just a couple months. The professional registered nurse's assessment and interventions helped make this positive response possible. Finally, mandating a school nurse in Virginia schools is important because school nurses, save lives. Having a school nurse present who can respond to the life-threatening emergencies can make a difference between the life and death for a student. In my career, I've witnessed many emergencies where school nurse administered life-saving assessment and treatment, including responding to severe hypoglycemia, anaphylaxis, respiratory distress, and overdose emergencies. Having the skill and experience to differentiate life-threatening symptoms and making timely treatment decisions is critical. When I think about this essential role of the school nurse, I remember a school nurse who saved a student's life who arrived to school unconscious and in a severe state of hypoglycemia. The nurse administered emergency glucagon and reversed this serious life-threatening situation. Without her immediate and skilled assessment and intervention, this student may not be with us today. Of the 1,932 schools, and you've heard some of these statistics already, who completed the VDOE School Health Data Survey last year, 67.81% reported having a full-time RN. But sadly, 19 of our schools have no school health coverage at all. So why do I feel it's important that a registered nurse be available to all Virginia students all day, every day? Understanding the different education levels and scope of practice of nurses and unlicensed assistive personnel helps to explain this. Just as licensed teachers have a more comprehensive educational preparation for teaching than an instructional assistant, so too registered nurses have more comprehensive educational preparation for the role of the school nurse than any other allied health workers. The Code of Virginia delineates the scope and practice of the different types of health professionals. In the school setting, the RN is the licensed nurse responsible for developing and implementing and managing a school health program for a school population as defined by the school division. RNs can function independently and often supervise LPNs and unlicensed assistive personnel in the school setting. Only RNs have the authority to independently perform the myriad of school health procedures for students with special health needs. Most RNs have a bachelor's degree at a minimum, and many, like so many of our educators, have advanced degrees in nursing and public health. LPNs in the school setting are responsible for components of the school health program for a school population as defined by the school division. LPNs report directly to a registered nurse, physician, or nurse practitioner and do not function independently. In the school setting, the LPN is often assigned to support a student with special health needs or procedures, but it's important to remember that all activities by the LPN need supervision. LPN programs are usually certificate programs which take approximately 12 months to complete. Unlicensed assistive personnel, or UAPs, are unlicensed paraprofessionals trained to perform care for individuals. UAPs are restricted in their scope of responsibilities and perform duties assigned under the direct supervision of a registered nurse or licensed practical nurse. Often, UAPs only have a high school diploma, and this depends, of course, on the requirements of the school division. So here on this slide, you can see a comparison of some of the duties permitted for each of these groups. It's imperative that we provide professional school nursing services for our children in Virginia. Registered nurses are best equipped to manage the overall complexities of school nursing services, and developing a mandate for these services will help ensure all of Virginia's children have access to this important service. Let's all contribute to the future of the Commonwealth by supporting the health and wellness of our children through the provision of a registered nurse in every school in Virginia. I really appreciate the opportunity to speak with you today, and I'm certainly happy to take any questions if you have any.
Thank you, Dr. Whalen. It was a wonderful presentation, and if you don't mind, we're going to keep your name as a reference. So when the Department of Education has to pull together these stakeholder groups, we'll talk to you, hopefully. But it was a very helpful presentation. Thank you. Are there any questions, colleagues? Well, you're getting off easy, I guess. People are worried about the rain.
Madam Chair,
Oh,
I
yeah,
just want to
Delegate
take a
Adams.
moment to thank you so much for that comprehensive report. I think it really succinctly encapsulates how many challenges school nurses look at in relative to our student body. And while I am not a parent myself, I've never met a parent who wouldn't give anything for their child. So it certainly seems this is the time in our life to be doing just that. So thank you so much.
Welcome. Thank you.
Thank you. Yes, Ms.
I
Linda?
just wanted to tag along with what Delegate Adams said. I appreciate the stories that you told us, because I
Really
think the
important.
stories amplify and exemplify sometimes nurses are viewed as for what we do instead of what's in our mind and what is behind the actions that we take. And so while looking simple, they're not, and those stories reflect that. Thank you.
Thank you so much.
Colleagues, the last item on our agenda is public comment. So if individuals wish to speak to the committee, you are welcome to do so. I would ask that you keep your comments to no more than 3 minutes, and you may sit in this chair if there's anybody in the audience who wishes to comment. And please indicate not only who you are, but what organization you represent or what group you are speaking on behalf of. Or
Madam Chair, thank you for giving me the opportunity to speak. My name is Betsy Looney, and I will be the Virginia Association of School Nurse President starting in January of this year. I've been the legislative chair for the past 4 years, and I have my bachelor's degree in nursing. I've been in school nursing for 25 years, and I'm also a national certified school nurse. I'm here today, first of all, to thank you for having this committee. We need this. We need an RN in every school. I personally have had to call 911 at least 25 times. I've had to use a tourniquet for an arterial bleed. You have to, in our school system, we're not just dealing with children with anaphylaxis, asthma. We're dealing with children that have mental health issues, suicide ideologies. A school nurse often is the person that the child will go to because they trust the school nurse. And a child might be cutting, which means self-harm. The nurse has to recognize that because that is important to prevent suicide. We all know that COVID has brought on so much more mental health issues for our children, which is sad. I know, Delegate Adams, you said you're not a parent. You are a parent. All of you are parents. You are representing all the students here in Virginia. And you are the matriarchs and patriarchs for our students. The one thing I would like to say thank you, because I spoke on behalf of the AED bill. My best friend's daughter died in school because there was not an AED there. And you guys passed that bill, and I want to thank you very much for doing that. But you need to continue to do that for our students. I'm very passionate about it. I brought here an example of the medication that you have mandated in our schools, some of them. This is the albuterol that is now mandated. We have EpiPens that are mandated, and there's different types of EpiPens, so every school might have a different one. We are now looking at mandating glucagon. Glucagon comes in either nasal or it also comes in injection form. This is something also that we will be looking into, I'm hoping, in the future, is that you will have Narcan in our schools. As you know, we've already had emergency medical situations in the public schools in Virginia that have required the use of Narcan to save a child. Now, with all of this and the AED, when a nurse comes upon a child that's unconscious, a registered nurse does have the extra training. You saw, piggybacking on Dr. Wallen's presentation, they do have that extra expertise. and you're asking us as a nurse to make that decision to save a child. I have saved children in my school. I am so grateful I could visit them in a hospital or their family instead of going to their funeral. It happens. It's not just blowing smoke. It just truly, truly does happen. We have children that, the reason we passed this, because we had a child die. So now we have epinephrine. Passed the AED because we've had children die. We passed the albuterol because we've had children die. We're Narcan, glucagon, and that's the albuterol. It's just so important. Other states have done it. They have found the funding to do it. I know we have SOQs. I don't know if there's a way to put in the wording that you must have an RN and additional staff, because there's funding there to do it. So I just feel maybe we need to look at all angles and make this happen. I firmly 100% believe it can. There's no doubt there's a need for it. There is absolutely no doubt. And that to have a registered nurse in all our public schools for all our students. And you are the parents, that's why you were elected, to represent all the students in Virginia along with your own districts. So I want to thank you for your time. I appreciate all your efforts. And again, thank you for your time.
Thank you. Thank you for your service. Is there anybody else who wishes to speak to the committee at this time? Welcome.
A little different than the last room. Good morning, or is it almost afternoon? Not yet. I'm Catherine Haynes. I have some of my representatives here, and I am the vice chair of the Chesterfield County Public Schools School Board that put a nurse in every school, and I'm also, because of my experience on the school board, now the health equity manager for Virginia Interfaith Center for Public Policy. On September 14th, 2020, we approved $500,000 of CARES funding so that we could have a nurse in every school. And why did we do it? We are all politicians, understand it was a political will. So our school board said this is what we were going to do and have maintained that commitment. So I'll have to push the next school board to keep it. Then I also pushed to move that funding into our operational budget, and we were able to do that, but less well-off districts will need a revenue stream to secure or maintain a nurse in every school. And on that note, I am asking that this committee consider making recommendations to the General Assembly and other policymakers to support the process for LEAs to obtain Medicaid reimbursement under the recently approved SPA. I believe this is the most efficient pathway to a nurse and an RN in every school because it provides revenue. And I would ask that you are proactive in removing barriers to accessing this funding, and I'll throw out 3 suggestions. The first is to recognize in some areas it will be hard to obtain parental consent. And so be proactive. DMAS can issue clear, easily shareable statements about what will happen with the data when a parent signs a consent form. It'll be important to communicate, perhaps with a short video, social media campaign, that no benefits or services that are provided to a child outside of the school will be reduced because of services provided in school. So that would be support to DMAS for this project. The second would be help with electronic health record system, because that, especially for rural and underfunded districts, would be a real barrier. A strong EHR system is expensive, and other states have provided support for this. And then 3, Virginia Interfaith Center for Public Policy is among the organizations advocating for Medicaid reimbursement for community health workers. CHW services could be billable by Medicaid under the clinical supervision of an RN. I mentioned CHWs because of their success increasing the access of vulnerable communities to healthcare services, because they are good at enrolling families in Medicaid, thus increasing revenue stream once you have access to Medicaid, in addition to playing a role in health. For example, a CHW asthma home visit program for children with uncontrolled asthma improved health outcomes and yielded a return on investment of 1.90. Chesterfield County, according to the VDOE School Health Data 22-23 survey, is one of the 13 Virginia school districts with asthma rates that higher than the Virginia and the U.S. average. And community health workers are also an entry point to nursing. So get a plug for CHWs. And if I have any time left, I'm just going to mention there's a lot of great data with VASIN. For example, a nurse in our school district, Christine Tyndall, in a Chesterfield County school of almost 2,000 students, piloted a school nurse rounds collaboration to really tackle the mental health support piece for our students. And 60% of the staff surveyed strongly agreed that school nurse rounds increase their awareness of the general needs and specific medical needs of students. 80% said it increased their awareness of students' mental health needs. Often the awareness just is not there. And 100% of the staff surveyed strongly agreed that you needed a registered nurse in every school. So it is a lot of support, and I look forward to the work of this committee. And you can feel free to reach out if you want to know more about the Chesterfield story. It's just providing the political cover, making it very clear that it is a priority. So I'll stay on the next board.
Thank you. I think the Association of School Boards might serve themselves well if they wanted to take a position on this. I'm working on that. So you can bring that back. And I also want to note for the audience and the committee, I believe DMAS is working on a process for helping schools actually draw down Medicaid dollars, because it can be complicated, and schools are probably leaving money on the table. And constituents and groups have come to me saying, please help us figure out how to draw down Medicaid dollars. So I guess, Mr. Bremer, the next meeting we have, which will probably be right after session, so then we can figure out how our budget amendments go, and we should be asked DMAS to give us a briefing on what they're doing to help schools draw down Medicaid. Because if that really improves, that could also be a little buffer for us to, maybe go forward with a mandate. So that would be good. Okay, colleagues, there's nothing more on our agenda unless you have issues you want to bring up.
So there were a lot of nurses who wanted to be here today, but since it was 10:30 on a school day, they didn't want to leave their students because they're committed to that. I did ask if we could have any virtual way to have them come in. That was not available yet in this room, I was told. So that is why I asked them to have any written testimonies. So I will just offer these to whoever might want to read them. Again, they're from RNs, LPNs. There were, I think, a couple parents in there. And
I think we need a broader, and I appreciate that, I do think we need a broader coalition than just the nurses, asking for nurses in every school.
well, there are teachers in there, there are parents, there are different things too, but I just wanted you to have their perspective.
We need school boards, we need
Absolutely.
Superintendents, we're going to need a broader coalition, just as a piece of advice in terms of getting things through. Maybe Voices for Children, other groups that want to take this issue on. It's always better to have a broader coalition than a smaller coalition, don't you think?
Agreed.
Yeah, okay. All right, well, colleagues, I can accept a motion. Is there a second? Okay, all those